Dr. Troy here from Zenaptic Chiropractic, Vancouver, Washington. I want to talk about adjusting the low back without using force, without hearing cracking sounds. So one of the things we start with is an analysis of pelvic dysfunction. And so first thing we're going to do is we're going to check the patient. And on this one, she indicates left short leg. So a couple ways we can analyze. I'm going to actually place the patient on some blocks. This actually helps free up the sacrum, which is a floating bone, which they used to call it the sacred bone. There's 5 vertebrae that make up the sacrum, and they fuse after you're about 20 to 24 years of age. So one of the things we want to notice here is when we check this, we put her on the blocks that actually balanced her legs. And we want to see if it's coming from the sacrum, other areas of the spine. So what we look for, we're going to look at L5, which is the lowest vertebra of the spine. And so I'm going to have her cough for me. Go ahead and cough. Okay. So her L5 actually moves up when she coughs, which is an indicator her sacrum has gone into a flexed position. So with that, we're just going to use light pressure. Take a deep breath in. And then we just use light force with the blocks, with her breathing, just to put motion back into that. Big breath in and let it go. Good, one more deep breath. And then we're just gonna set that right there just in motion. Sometimes we can use a light thrust, but for this, you're not gonna hear any cracking sounds. I know a lot of people get scared of that. So we just use a light, gentle force, and we just retest the leg length, and she balances out. Now, if the sacrum rocks into extension, meaning it comes backwards, we're gonna test L5, we're gonna have them cough. And if L5 moves down, it's a different adjustment that we use. Or if L5 moves straight out, that tells us that the sacrum's clear, that we don't need to focus on adjusting that to correct that discrepancy in the leg length. Over time, if a leg's short, it's gonna torque the pelvis, gonna torque the knee, torque the ankle. Over time, that can lead to degeneration in the hip socket, knee, even ankle issues, foot issues. So very important to get checked. This is one of the analyses we use. Let's just double check her, make sure she's staying balanced, and she is. So I would say good to go. Power's on. Check your next visit. This is Dr. Troy, the Zenaptic Chiropractor. If you're interested in coming in, call our office. We'd be happy to do a consultation, see if we can help get you back on track.